Thank you, Mr. Chairman, and thank you, Madam Secretary, for your testimony this morning. On February 19th, as part of the FY 2017 Medicare Advantage rate notice, CMS proposed a cut to Medicare Advantage employer group waiver plans, otherwise known as Medicare Advantage Retiree Coverage. 3.3 million seniors receive their Medicare Advantage coverage through this plan. In fact, in Michigan alone, there are more than 300,000 retirees, including labor unions, state and local government, and private employer retirees who rely on Medicare Advantage retiree coverage. These proposed cuts would jeopardize the high-quality care that they depend on for their health and financial security. That's why last week my colleague, Representative Debbie Dingell, and I led a bipartisan Michigan delegation letter that included 11 of our colleagues in Michigan to raise concerns with regard to the impact these proposed cuts would have on our constituents, and we also urged the agency to remove the cut to the Medicare Advantage retiree coverage from the final rate notice. Earlier this month, the UAW Retiree Medical Benefits Trust, which provides health coverage to retirees and their dependents of the United Auto Workers Union, who formerly worked for the Michigan's Big Three, GM, Ford, and Chrysler, submitted comments to CMS expressing concerns with CMS's proposed cuts to Medicare Advantage retiree coverage that impact these cuts and the impact these cuts will have on their retirees. The trust currently provides coverage to 719,000 people. Of this population, 534,000 are covered by Medicare. The trust offers their retirees a choice of plans in which they can enroll. At the present time, 161,000 of these retirees have selected and are covered by Medicare Advantage plans. In comments submitted to CMS, the UAW Retiree Medical Benefits Trust expressed concerns that the proposed cuts to Medicare Advantage retiree coverage might result in diminishing the quality of care available to retirees, and the proposal would lead to substantial reduction in payment to employee group waiver plans, thereby resulting in premium increases and/or benefit reductions. This leads me to my question. I did send you this letter, and I appreciate the fact that you've acknowledged receipt of that letter. Thank you very much for that. Having said what I just said and the grave concerns that they represent to, in particular, my constituents in the state of Michigan, can you tell me whether or not CMS considered the impact the cuts to Medicare Advantage retiree coverage would have on the 3.3 million seniors who depend on this form of coverage when developing the advance notice?
So we did and appreciate that and appreciate the letter that you have sent. And we are in an open comment period, so welcome the comments and the concerns. And we did consider this issue. And we actually looked to our experience when we did this change in Part D. And we did not see the impact that folks are saying could happen. We did not see that impact occur. And so we, like you, want to make sure affordability is an important part of it. In our work, what we try and balance is affordability for the individual as well as affordability for the taxpayer with the Medicare dollars, and feel that it is a proposal that meets those. But we want to continue to hear the comments and see if there's something that would distinguish it from the experience we previously had.
And have you responded to the UAW's concerns as well?
Probably because it is a part of the comment in the rulemaking process. Most likely we took it in as a formal comment, but I'm not sure how they did it, whether it was in the form of a letter or a comment. So I don't know specifically, but it will most likely be a part of the record for the comment period.
Thank you, Madam Secretary. Now I yield back.
Gentleman